Now, this morning, I have the privilege of sitting in studio and talking and being a bit educated this morning on the idea and the whole medical concept of radiography. And to have that conversation with me, I have Mr. Brent Sterling. Good morning and welcome.
Pleasant morning. Thanks for having me.
It's a pleasure to have you here. Now, this week we're talking about World Radiography Week, and persons often get radiology and radiography confused. So, give us the core separations when we think about radiology on a whole and the radiography in regards to the imaging.
Well, radiology is the all-encompassing title you give it to the entire profession, which includes other doctors and other professionals in the program. Radiography specifically speaks to radiographers and the procedures and the way in which we go about acquiring the medical images.
Right. And when we think about radiography, we often think about x-rays. So tell us about some of the areas that encompass radiography. What are some of the reasons why someone would come in to get some of your services?
Well, the genesis of radiology comes from radiography when x-rays was invented in the late 1895, so in the last century or so. And it has morphed into a booming and a very exciting profession. Well, radiography basically deals with the acquiring of diagnostic images, and then those images are then used to understand the body and the different functions. So in the original settings, it started out as x-rays, so most persons will be familiar with calling the department x-ray department. But as time has evolved and progress has been made, the profession has evolved into more than just x-rays. So the new title is diagnostic imaging. So our main focus now is basically helping doctors in diagnosis and treatment. So as for now, we have most of the modalities up and running at the hospital, which include general x-rays, we have fluoroscopy, we have CT, MRI, ultrasound.
Right. And the most frequent one is an ultrasound. You would see, on a regular basis, someone has to do an ultrasound, whether it's because of pregnancy or just to identify, mass within the body, or like the one that they do on their feet when you have like to identify a blood clot. We
Right,
call that one
DVT.
the DVT.
Correct.
That's one that is done quite frequently as well.
Yes.
But as you indicated, there are other areas that fall under that. And persons don't know until it's a situation where a doctor says, you have to go to this particular scan. My question is, what capacity does the current system in Tobago have to facilitate persons who want to do, let's say, just a checkup in the public system?
Well, let me go from the beginning. Well, for this year, we are highlighting the profession of radiography. And the theme is radiographers seeing the unseen. So most of the times, whatever disease condition or investigation that is needed, people want a literal insight. And our profession affords us the ability to have all the modalities needed to do those things. As it regards to what is necessary to be done, a lot of the times people think that you have to have your whole body scanned to get whatever concerns they have analyzed or investigated by the doctor. However, we have to be very cautious in use of our finite resources. So one of our programs this week is actually later on today, where we are having a symposium with the medical doctors and other allied health workers, sensitizing them on how we should approach requesting images or different tests for the patient so that we can properly manage our resources as it relates to if you just want to get a general checkup. Usually when you visit a doctor in the department, based off what query they have, then they will generate an X-ray request, which is a medical legal document. So it should be treated as such. And you come to the department. It depends on the type of modality you want. If it's X-rays, then most of the times from between 8 to 4 p.m., you can get all those imagings done in terms of x-rays, but in after hours, it will go through mostly the wards and A&E.
Right. And the exposure to radio frequency produced by these devices often can have a negative impact on the human body, in that there's a limit to how much a person can do and how frequently. Can you tell us more about that?
Well, we generally check or monitor the machine in terms of how much radiation dose is actually given out. So we had a physicist in the last few years who came to monitor, to check, to ensure that all safety protocols are being respected and followed. So last year's theme, we were looking at patient safety. So we had all those things done last year to ensure that the machines were giving the right amount of radiation to the patient. There is a universal standard in terms of how many millisieverts a patient is supposed to be able to get within a year. And so far, we have not exceeded that for anybody so far. So that's a great achievement for us.
Right. And let's look at diseases like cancer. Persons often doing radio imaging for things like that to maybe see how far-reaching the cancer has spread and what organs may have been affected so far.
Well, unfortunately, in Tobago, we have seen an uptake in the number of incidental findings, I would put it, of persons having queries in terms of masses or conditions which are later on deemed to be cancerous. Currently, we use our medical imaging techniques and technology to identify when a suspected cancer patient comes in, whether the query is about whether it's a colon cancer or prostate cancer. So having seen this, the TRHA has done an amazing job in kind of starting to boost the awareness, especially for females. So last month was Breast Cancer Month, and the hospital or department was instrumental in carrying a program which is basically outreach to women over 50 for mammography tests.
Okay, excellent. And so tell us more about the actual symposium that you guys are having.
Well, the symposium we're having now is mostly focused on addressing some of the concerns and some of the new changes that we're going to have in the department for the doctors and other medical professions. So this will highlight basic etiquette, in terms of writing requests, how we should evaluate patients who may or may not need a certain type of examination, and how best to help them to narrow down the specific modality or a more appropriate modality to request for certain examinations.
And how can the public be a part of this?
Well, on Friday, we are having our Public Awareness Day. So when we have all the pamphlets out, we have a booth where people can come in and ask questions and get all the misconceptions and myths out that they may have about the profession and how to get certain access to certain modalities.
All right. And so persons can come out and be a part of that. This is at the hospital?
Yes, this is at the hospital and at the department. And for those who want a more fun approach to things, we are having a treasure hunt tomorrow. So that is also exciting, where you have fun and games as well as the opportunity to learn, win prizes, but also get familiar with the services offered.
Is this treasure hunt also happening at the hospital?
Yes, it's happening at the hospital's courtyard.
All right, so this is for maybe persons who are working in the building,
Anyone
or
who is
if
there
you're
at
a
the
member of the
moment.
public and you
Yes.
happen to be at the hospital tomorrow, you can participate
Yes,
in
please.
that treasure
hunt.
hunt. So you can make a sad moment happy, because no one really likes being at the hospital.
Quite so.
So, all right, we want to thank you so much for being here this morning. Thank you for educating us and allowing us to understand more about what your unit does. So before you go, is there anything that you want to include?
Well, yes, one of our big drives this year is to highlight the profession to aspiring radiographers. So we have a school caravan going around this week. So we have both sides of the island covered. So we have invited specific targeted schools to come into the department, as well as the staff will be visiting schools to highlight the profession, how to get in, and what other fields that it can lead to.
All right, so we want to thank you so much, and we hope that young persons are more interested in getting into the profession by means of you being at their school and making it fun and interesting. You know, I hope you have those games, you know, those quizzes and stuff that get the kids really excited and engaged. So thank you so much, Mr. Sterling, for being a part of our conversation this morning. Guys, we're going to take a quick break right here, and we're going to be back right after this. See you soon.